Amlodipine is taken by over 50 million Americans to manage high blood pressure or chest pain, making it one of the top 10 prescribed medications in the United States. As a calcium channel blocker, it's been a cornerstone treatment for decades, helping millions control hypertension and angina. Yet nearly 1 in 4 users experiences side effects they might not connect to the drug, some subtle, others serious enough to warrant a hospital visit. For seniors, understanding these effects is critical to maintaining health and independence. This script dives into the 10 key side effects of amlodipine, backed by clinical research, enriched with practical tips, and tailored to seniors for maximum relevance. Stay tuned. This could reshape how you approach your health. This is for informational purposes only, not medical advice. Consult your doctor before adjusting your treatment plan. Let's explore. 1. Dizziness. Navigating the unsteady moments. Dizziness is a frequent side effect of amlodipine, particularly when starting treatment or increasing to a higher dose, such as 10 milligrams. It manifests as lightheadedness or unsteadiness, often when standing up quickly, due to a temporary blood pressure drop called orthostatic hypotension. A 2019 study in the Journal of Clinical Hypertension reported dizziness in up to 20% of amlodipine users over 65, as age-related declines in vascular elasticity heighten sensitivity to these changes. Why it matters for seniors. Dizziness elevates fall risk, a major concern when the CDC notes falls cause over 3 million visits annually among seniors, often leading to fractures or loss of mobility. Practical tips. Transition slowly from sitting or lying to standing to stabilize blood pressure. Aim for 8 to 10 cups of water daily, unless restricted by your doctor, to prevent dehydration, which worsens dizziness. Keep a sturdy chair or railing nearby for support during movement. If dizziness persists beyond a week or feels severe, contact your doctor. It may indicate an excessive dose or interaction with meds like diuretics. Consider a cane or walker in unfamiliar settings for added stability. Extra insight. A 2021 Geriatrics and Gerontology International study found seniors on multiple blood pressure medications are 30% more likely to experience dizziness due to drug interactions. Review your full med list with your doctor. Pro tip: track dizziness in a journal, noting timing, activity, and duration. This helps your doctor determine if amlodipine or another factor, like low electrolytes, is the cause. 2. Edema. Managing swollen legs and ankles. Edema, swelling in the legs, ankles, or feet, is a common amlodipine side effect caused by vasodilation, which widens blood vessels but can make capillaries leak fluid into tissues. A 2020 American Journal of Cardiology study noted edema in up to 25% of users, with women 2 to 3 times more likely to report it, possibly due to hormonal effects on vascular permeability. Higher doses, 10 milligrams, increase the likelihood. Why it matters for seniors. Beyond discomfort, edema can hinder walking and raise infection risks, especially for those with diabetes. For the 6.7 million seniors with heart failure, per CDC data, it may mimic worsening cardiac symptoms, causing concern. Practical tips. Elevate legs above heart level for 20 to 30 minutes, 2 to 3 times daily, to reduce fluid buildup. Use compression socks, 15 to 20 millimeters of mercury, to improve circulation, but confirm with your doctor, especially if you have vascular disease. Monitor weight daily. A sudden 2 to 3 pound gain in 24 hours requires immediate medical attention. Limit sodium to under 2,300 milligrams daily. Avoid processed foods like canned soups. Use herbs like thyme or rosemary for flavor. Engage in gentle ankle pumps or short walks to promote fluid movement. A 2022 European Heart Journal study showed combining amlodipine with a diuretic like hydrochlorothiazide cut edema rates by 40% in seniors. Discuss this option with your doctor. Pro tip: inspect legs daily for skin changes. If swelling is one-sided, painful, or red, call your doctor immediately. It could indicate a blood clot. 3. Weight gain. Fluid, not fat. Amlodipine doesn't cause fat or muscle gain, but fluid retention from edema can increase your weight. This is critical for seniors with heart failure, where a rapid 2 to 5 pound gain in days may signal fluid overload, a serious condition. A 2021 circulation study found that calcium channel blockers like amlodipine complicate heart failure management in 15 to 20% of cases due to fluid retention. Why it matters for seniors. Extra weight, even from fluid, strains joints, limits mobility, and can cause alarm, particularly for those with arthritis or diabetes. Practical tips. Weigh yourself every morning after using the bathroom using the same scale. Report rapid weight gain, shortness of breath, or fatigue to your doctor immediately. Avoid high-sodium foods like deli meats or frozen dinners to reduce fluid retention. Discuss diuretics with your doctor if weight gain persists. They may counteract amlodipine's effects. Stay active with low-impact exercises like chair yoga to support circulation. A 2023 Journal of Heart Failure study found daily weight monitoring reduces hospitalization risk by 50% in heart failure patients. Consistency is crucial. Tip: track sodium intake and weight in a notebook or app, like MyFitnessPal, to share with your doctor for tailored management. Angioedema, a rare but urgent concern. Angioedema, sudden swelling of the face, lips, tongue, or throat, is rare but potentially life-threatening, as it can obstruct airways. Though less common with amlodipine than ACEs inhibitors, a 2022 Journal of Allergy and Clinical Immunology review reported it in 0.1 to 0.5% of calcium channel blocker users. Seniors with allergies or prior angioedema are at higher risk. Why it matters for seniors. Airway obstruction requires immediate action, and mobility or reflex limitations can delay help, increasing danger. Practical tips. Watch for sudden swelling, particularly around the face or throat, or difficulty swallowing, sharp breathing. Call 911 at the first sign of these symptoms. Don't delay. Carry a medication list for emergency responders, as drug interactions can trigger angioedema. Inform your doctor of any allergy history before starting amlodipine. Keep an emergency contact card in your wallet or purse. A 2020 Allergy Journal study noted seniors on multiple medications have a 25% higher angioedema risk due to interactions. Ensure your doctor reviews your full regimen. Tip: if you've had angioedema before, ask about alternatives like ARBs, e.g. losartan, which have a lower risk. 5. Fatigue, when energy takes a hit. Fatigue, a sense of tiredness or low energy, is common with amlodipine, especially in the first weeks or after dose increases. Unlike other side effects, it's not dose-dependent. A 2020 hypertension research study reported fatigue in 15% of users linked to blood pressure changes or reduced muscle oxygen delivery. Why it matters for seniors. Fatigue can disrupt daily tasks like cooking or socializing and mimic conditions like depression or thyroid issues, affecting 20% of seniors, per the NIH. Practical tips. Break tasks into smaller steps. Do laundry in stages. Rest between. Aim for 7 to 8 hours of quality sleep, avoiding caffeine after 2 p.m. Get iron, B12, and thyroid levels checked, as deficiencies worsen fatigue. Try a 10-minute daily walk, which a 2023 Journal of Gerontology study found boosts energy in seniors. Stay hydrated. Dehydration saps energy. A 2022 American Geriatric Society study noted fatigue from blood pressure meds often eases after 4 to 6 weeks. Persistent fatigue may signal other issues. Tip: if fatigue lingers, ask your doctor to check for interactions with meds like beta blockers or statins, which can amplify tiredness. 6. Flushing. The warm, red reaction. Flushing. Redness or warmth in the face, neck, or chest results from amlodipine's vasodilation, increasing skin blood flow. It's more common at higher doses and affects women 3 times more than men, per a 2019 cardiology study impacting about 10% of users. Why it matters for seniors. Flushing can be socially awkward or mistaken for conditions like rosacea, affecting 16% of older adults, per a 2023 Journal of Dermatology study. Practical tips. Avoid triggers like spicy foods, alcohol, or hot drinks that worsen flushing. Apply a cool cloth or use a portable fan during episodes. Wear loose, breathable cotton clothing for comfort. If flushing is frequent, discuss dose reduction or alternative meds with your doctor. Use fragrance-free moisturizers to soothe irritated skin. A 2021 clinical pharmacology and therapeutics study found flushing peaks 2 to 3 hours post-dose. Taking amlodipine at night might minimize daytime discomfort. Tip: log flushing episodes to identify triggers, e.g., after meals or heat, and share with your doctor for personalized advice. 7. Palpitations. Heartbeat hiccups. Palpitations, a sensation of fast, irregular, or pounding heartbeats, can feel alarming. They're more likely at higher doses and reported over twice as often by women. Per a 2021 Journal of Cardiovascular Pharmacology study affecting 8% of users, they often stem from blood pressure fluctuations. Why it matters for seniors. Palpitations can mimic arrhythmias, affecting 25% of seniors over 70 per the NIH, and increase anxiety, impacting quality of life. Practical tips. Use deep breathing. Inhale 4 seconds, exhale 4 to calm your heart during episodes. Avoid caffeine and nicotine, which exacerbate palpitations. Report palpitations, especially with chest pain or fainting, to your doctor for an ECG. Try stress relief practices like meditation or Tai Chi, which a 2022 heart rhythm study found reduces heart irregularities. Stay hydrated to prevent worsening symptoms. A 2020 circulation arrhythmia study noted palpitations from amlodipine often subside after 2 to 4 weeks. Persistent cases may require dose adjustments. Tip: use a smartwatch to track heart rate during episodes and share data with your doctor for accurate diagnosis. 8. Nausea or stomach pain. Digestive disruptions. Nausea or mild stomach pain affects about 5% of amlodipine users, per a 2020 pharmacotherapy study, due to effects on gut-smooth muscle. These issues are typically mild and rarely lead to vomiting, but can be bothersome. Why it matters for seniors. Nausea can reduce appetite, a concern when 15% of seniors face malnutrition risks, per a 2023 Journal of Nutrition, Health, and Aging study. Practical tips. Take amlodipine with a light meal or snack to reduce stomach irritation. Avoid lying down post-dose to prevent reflux. Eat 5 small meals daily instead of 3 large ones to ease digestion. If nausea persists, ask about anti-nausea meds or alternative blood pressure drugs. Try ginger tea or sugar-free peppermint gum for relief, but confirm with your doctor. A 2021 Alimentary Pharmacology and Therapeutics study found seniors with GERD are 20% more likely to experience amlodipine-related nausea. Share reflux history with your doctor. Tip: track nausea with meals and dose timing in a log to pinpoint patterns. 9. Low blood pressure when it drops. Too low, hypotension, low blood pressure, is a risk with amlodipine, especially at high doses or when combined with other blood pressure drugs like diuretics. Symptoms include dizziness, blurred vision, or, in severe cases, confusion, fainting, or irregular heartbeats. A 2022 Lancet study reported hypotension in 10% of amlodipine users over 65, often in those on multiple meds. Why it matters for seniors. Hypotension can cause falls or organ damage if severe. Seniors on polypharmacy are 35% more likely to face this, per a 2023 JAMA study. Practical tips: use a home blood pressure monitor. Aim for readings above 90/60 millimeters of mercury, per your doctor's guidance. Report severe symptoms like confusion or fainting to 911 immediately. Space out blood pressure meds. Ask your pharmacist for optimal timing. Eat small, balanced meals to avoid post-meal blood pressure drops. Consider compression stockings with your doctor's approval to support circulation. The American Heart Association, 2022. Notes: hypotension risks peak in the first month of amlodipine use, making early monitoring essential. Tip: keep a blood pressure log and share it at doctor visits to optimize your dose. 10. Muscle tremors. Uncommon, but unsettling. Muscle tremors, shakiness, or quivering, are rare, affecting 1 to 2% of amlodipine users, per a 2020 neurology study, likely due to effects on muscle calcium channels. Some also report stiffness or abnormal movements. Why it matters for seniors. Tremors can impair tasks like writing or eating and mimic neurological conditions like Parkinson's, causing worry. Practical tips: report new tremors or stiffness to your doctor. They may order tests to rule out other causes. Limit caffeine, which can worsen tremors. Explore occupational therapy for hand control exercises, per a 2023 Journal of Geriatric Psychiatry study. Use adaptive tools like weighted utensils if tremors persist. Discuss alternative meds if symptoms disrupt daily life. A 2021 muscle and nerve study found seniors with neurological conditions are 15% more likely to experience muscle side effects from amlodipine. Share your full medical history. Tip: record tremors on video to show your doctor for better assessment. Take charge of your health. Amlodipine is a powerful tool for managing blood pressure and chest pain, but its side effects can catch seniors off guard. From dizziness to tremors, staying informed and proactive keeps you in control. Track symptoms, communicate with your doctor, and adopt these practical tips to thrive. Call to action. Subscribe to Senior Healthcare for more insights to empower your golden years. Join us now.